Hi, my name's Paula Monticelli, and I'm the Director of Basing for the Navy Secretariat. In July, ADC's COVID-19 Military Support Initiative launched a Military Installation Management and Community Partnership Working Group. This group looked at how our installations in surrounding communities adapted their operations and leveraged partnerships in response to this pandemic. Hearing the stories about how our installations and communities came together during this time of crisis was truly inspiring. One of the key takeaways from this analysis was the fact that leveraging existing partnerships was so much easier than establishing new ones during a pandemic. Building and nurturing these types of relationships truly benefit us all.
Good afternoon. My name is Kathleen Ferguson. I'm an ADC board member and also a senior advisor at the Roosevelt Group. This afternoon, I'm going to summarize the results of the working group under the COVID Military Support Initiative for Installation Community Crisis Response. This working group discussed how communities and installations partnered to provide emergency COVID response services and to identify best practices that could be shared. Our review showed positive partnerships could reap benefits for installations in their communities during times of crises. In many cases, the military installation leadership saw a need for COVID-19 related services in response and looked to their local communities. Likewise, the community looked to military installations for support and vital information. For example, installations with success stories of acquiring or supplying personal protective equipment already had partnerships in place with local community leaders or advocates. Next, we found that partnering of the military with local communities for testing and tracing became a vital effort. Over 70% of our military members and their families live and work in the community, and the virus does not recognize base boundaries. Additionally, medical partnerships, such as the one at Naval Air Station Pensacola, were crucial. The installation partnered with the local Baptist hospital system in preparation for COVID-19 related intensive care unit shortages. On-base facilities were prepped for patient care under the agreement that the installation would house non-COVID patients for the civilian hospital. In Kentucky, the Air National Guard and the Army Corps of Engineers teamed with Kentucky Emergency Management and the Department of Public Health to transform the Kentucky Fair and Exposition Center into an alternate care facility for patients recovering from COVID-19. Finally, we looked at family and wellness. A recent Blue Star Families Resilience Under Stress survey reported positive statistics about the importance of military families' ties to the local communities and how such ties can bolster health. The data demonstrates that a majority of military families have stronger ties to their local communities as a result of this pandemic. To briefly summarize our working group takeaways and potential policy recommendations. Number one, crisis response innovation and public-private partnership works best when an existing relationship exists between the installation and the outside. Communities and installations need to be in contact before the crisis occurs. Second, many states don't have a central state commission devoted to military affairs or a state organization that connects bases to each other and to the community. Building such alliances make public-private partnerships during a time of crisis that much more efficient and advantageous to state citizens and the military members within those states. And lastly, the communication between installations and outside communities has to be continual in two-way. The goal is to share best practices from partnerships built during the pandemic and continue to find ways for installations and their communities to work together. Thanks for participating in this session this afternoon, and I hope you find it beneficial.